Aaron Black. I was born originally in Minnesota, but my family moved to Colorado when I was 10, so I grew up in Evergreen. So I went to undergrad at Colorado College down in Colorado Springs and studied biology and Italian. And then I did a master's degree at Loyola in Chicago and did some research at Northwestern at that time. And then I went to Drexel in Philadelphia for medical school. And then I went to Tufts in New England Baptist in Boston for my residency, and then I did my sports medicine and ski trauma fellowship at Taos Orthopedic Institute, Taos, New Mexico. I do a lot of complex knee and shoulder arthroscopic surgery in the whole life cycle, from small arthroscopic procedures and non-operative management up through knee replacements and shoulder replacements and partial knee replacements. And within the knee, I do a complex knee. I have one of the highest volume multi-ligamentous knee injury practices in the counties, as well as I have a special interest in cartilage restoration, so cartilage transplants and complex cartilage procedures, osteotomy, which is realignment procedures, and then I treat rotator cuffs. I'm the only board-certified physician in this county who does shoulder replacements. And the other portion of what I take care of is what classifies as orthobiologics, which is using your own tissues and blood to help treat a variety of issues, specifically mild to moderate arthritis in most joints or insertional tendon issues. My philosophy of care, I think, boils down to it's about the patient. It's about getting someone back to the things they want to do. And I think it's very important that when I talk to my patients, the way that I counsel and teach them is also part of that. It's part about getting back to what you really love and care about and understanding, how to start over again and get back to where you're not thinking about it anymore. Athletes want to get back to 100%, not 95, like all the way to 100. And so that demand pushes me to be better at what I do. And seeing people get back to just the highest level of athletic performance is one of the most satisfying things that I could possibly do as a doctor. I enjoy the abstraction and the difficulty of performing things arthroscopically. My patient population and the people I get to interact with are my absolute favorite. As the doc who was the first one in this practice and opened the doors here, and what I've tried to push forward and create as an environment is our core tenet is we want to take care of the entire community. All comers, all people, and provide world-class, second to none level of care in an environment that's inviting. In the summers, I ride a lot of mountain bikes and I am outside and road bikes. And then in the winter, skiing. Skiing has been the biggest part of my life. I've been skiing since I was about 3, and it's pretty fun. And then I'm a U.S. ski team doc too, so that's a big part of what I do in the winters as I travel with it. Usually women's alpine, but with several different parts of the U.S. ski team. That's why I get along with my patients, is I know what people are trying to get back to. I know the specifics of what they want to do.